Hello and welcome to our worldwide friends on the web and of course every Monday, Wednesday, and Friday on Eagle Country. It's Pet Tips with Dr. Joel Saylor of Town and Country. This week we're going to be talking about Pyometra. I don't know what it is either, but the doctor does.
Yeah, I wanted to talk a little bit about Pyometra. And what Pyometra kind of sounds exotic, doesn't it? But basically, if you break it down into its word roots, it's basically an infected uterus. So pyo, anytime you see the word pyo, P-Y-O, okay, that means pus. And anytime you see metra or metro, that is referring to the uterus. Okay, you've heard of endometritis.
Right.
Okay, well that's inflammation on the inside of the uterus. Okay, so what Pyometra means, literally, pus uterus.
So I don't have that problem.
I would hope not, and I would hope no one had it. But it's a very common condition that we see in dogs. And what happens is that the dog that is intact. Okay, if they've been spayed, they can't have this. Okay, but if the dog's intact, they've been having heat cycles. A lot of times, the dog will have had a heat cycle a month or so ago, and one of the early symptoms is start drinking more water, which is really kind of odd. You don't think about that with that, but they start having excessive thirst. We just had one recently that basically just hadn't been feeling well and was actually leaking urine. And mainly because when we got in there surgically removed this thing was huge. And so it was literally putting pressure just like a pregnant female would, of putting pressure on the bladder and leaking urine. These things can be life-threatening. If they're kept unchecked, they will actually rupture, and then all that infection will be in the abdomen. And so a lot of times when these things are small, the dog can't say, hey, I haven't feeling quite right, and so it's one of those things that we one of the reasons why we advocate spaying, because if you're not going to breed the animal, getting them spayed sooner than later is a good thing, because then you don't have to worry about that.
Sure.
And a lot of times when the animal comes in, if it's a female and they've been drinking more water, the first thing I'm going to look at is have they been spayed, because then that checks one of the boxes immediately for excessive thirst and urination, and you go then on down to the next one. But like this one here, I was doing the physical exam, and they hadn't mentioned that there was excessive thirst. I felt the abdomen and it felt doughy, and I said, is this dog spayed? And she said, nope, hadn't been spayed. I was meaning to do that. And so there you go. And so again, the outcome of that surgery was good, went well. And so you have to, again, if you can intervene and catch them, they do well. So that is, if you haven't spayed your pet, okay, and that's one of those things you had been intended to do, as you get into this year or beginning of next year with your New Year's resolution, make that, at the top of your list.
All right, and we'll be back right after this.